I have never met another child quite like him. He is the most determined child. He is also the most courageous, cheerful, spunky kid at such a young age.
Unfortunately, Cohen was in a lawnmower accident where the lawnmower injured his left leg. He was transferred to Loyola where he was taken to surgery emergently. He was found to have a large injury to his medial thigh and knee where most of his distal femur was lost along with the muscle and skin. And so he's so young, he was only 3 years old, and so trying to figure out an option for him that will allow him to be somewhat of a normal kid, to have good function, to minimize the amount of surgeries we need to have over his lifetime. All those factors were factored into his surgical treatment.
Dr. Hodo came into our room and they explained, yeah, it's called a rotationplasty. And I said, what do you mean by that? And they said, we are going to make his ankle his knee, but we're going to turn it backwards.
Rotationplasty is a form of amputation that allows salvage of a knee joint. In Cohen's particular case, his distal femur was lost. In order to keep a knee joint or have some form of below knee amputation, the tibia was rotated 180 degrees and fused with his remaining femur, allowing his ankle to be a knee joint. This converts his partial amputation into a below knee amputation, allowing his ankle to function as a knee joint.
They were very patient with us, obviously, to have us, have time to think and weighing all our options, and they were pretty clear about any questions that we had, they answered.
I don't act all shy now.
So Dr. Hodo was just so kind and talking it out with us for days on end until we came to this decision that we were like, no, this rotationplasty will give him the best option for mobility in the future. He's still going to be able to do all the things that a 4-year-old, at the time he was 3, do.
He was almost a month in the hospital.
Whoa, Cohen!
Cohen, it's hard to get Cohen down. He's still Cohen. He just finds joy in anything.
Cohen did great. Honestly, better than I would expect in a kid his age, but Cohen is very resilient.
So the whole staff from start to finish was awesome. Dr. Hodo and Dr. Kuzma took their time with us. We appreciated it. This was a major surgery for our son.
This is our second prosthesis. He adapted to it very well. He's good at a lot of sports and stuff, so he has really good balance, and he just took off.
He never was freaked out by the whole idea of having his leg on backwards, as some would say. He has great range of motion of his ankle, which will allow him to have a great ability to use his prosthesis. I would attribute that to his wonderful parents who have educated him well about his situation and also worked really hard with him.
You do put it on there.
He is so resilient, so courageous, cheerful, and just determined. After watching the Paralympics this past winter, he has decided he wants to be a Paralympian one day.
My hopes and dreams for him is just living his best life.